Well, good morning, team. My name is Adam Meyer, and I serve as a member of the Commission on Magnet Executive Committee. I'm calling today on behalf of the Commission on Magnet and the Magnet Program Office staff, in particular, Beth Prusky, Senior Analyst, and Marguerite Smalls, Magnet Senior Specialist, as well as the Magnet Appraiser team. Colleagues, the Commission has reviewed all of your submitted documentation and the findings from your recent site visit. And as a result of the final review, it is my high honor and privilege to officially notify you that the Commission on Magnet has unanimously voted to credential Jefferson Health, New Jersey as a Magnet organization. Congratulations. I love it. This is one of my favorite parts of the morning. I'd like to take a minute to share some observations made by the members of the Commission on Magnet while reviewing your organization's documentation and some exemplars that were identified in the course of your organization's appraisal. Specifically, 3 exemplars that stood out to the team. The first being your organizations work with improvement in your central line associated bloodstream infections. So the unit level data for CLABSIs outperformed the vendor's national median and comparison cohort for the majority of the 8 quarters on 100% of your units. Additionally, the work that your teams have done around catheter-associated urinary tract infections and the unit level data submitted for reducing CAUTIs as compared to the vendor's national median and comparison cohorts for the majority of 8 quarters. And finally, the phenomenal work that you guys have done around in your ambulatory setting, nurse-sensitive clinical indicator of surgical errors and adverse outcomes of care, wrong site, patient, procedure, implant, or device, outperforming the median and comparison cohort for the majority of 8 quarters on 100% of the units. This is incredible. I'm honored to serve alongside of you, and I just want to congratulate you on this phenomenal work that you all have done. The majority of this work, particularly done in some of the darkest days of the pandemic. And it's a testament to the interprofessional team and nursing, the work that you all do. If you all are planning on attending Magnet Conference in Chicago in October, which we hope you are, your organization will be recognized, and I so look forward to seeing you there. In conclusion, Jefferson Health New Jersey is one of 33 Magnet organizations in New Jersey, and the Commission on Magnet recognizes your organization's dedication to the nurses who practice there, the entire healthcare team, but most importantly, the patients that you serve. Congratulations, Helene. I will turn it over to you.
Thank you. Adam, thank you so much. And, when I got the call last Friday, and, normally I don't answer when I don't know the number, and I didn't know the number, but I saw it was Silver Spring, so I sort of kind of thought maybe. Wonderful. This is such an honor. This is our second redesignation, our second designation. And, you said it, Adam, in the midst of the darkest days of the pandemic, this organization kept our patients safe by having very, very low infection rates in the operating rooms, surgical services throughout, and amongst all of our units. And that speaks to me of the quality of nursing care that we have here at Jefferson, New Jersey. I am honored to be this chief nurse for this organization. And it is a testament to the quality of nursing care that we provide. So thank you, everyone. And now it's time to just celebrate. So everybody, if you want to just unmute yourself and join us in a round of applause.
Helene, again, congratulations to you and the team. I know that you all will be spending the day, the week, the month celebrating this huge accomplishment. Again, we look forward to seeing you guys in Chicago Stay safe, everybody, and congratulations.
I really want to thank Sue, Angie, and Beth for all that you do. You know, you are the backbone behind all of this, but it is really our clinical nurses that we are celebrating tonight. And all of the leaders who make it so good for our clinical nurses. That is everybody in this room. I want to thank our board member for attending, and our dear friend, Dr. Dombrowski.
Less than 10%, right? So
hospitals, New Jersey has the most number of magnet hospitals.
Which makes sense for our population and our quality of care, but you know, we can't underestimate the quality of care that you provide on a daily basis. And we look at, you know, what goes into it. Yes, it's the entire team, it's the physicians, it's the nurses, it's the therapists, it's the EVS workers, but really who is at the root of everything and at that patient's bedside 24 hours a day, it's all of you. So thank you for making a commitment to our patients and overall to Jefferson. Congratulations.
I need to thank our team, our amazing team who harassed you and begged you for more when you thought you had given all the information that you could, particularly Beth, who probably wrote at least 80% of the stories with your input, and Angie, who wrote stories and did every one of our graphs and made them Sue Fulginetti, our little tiny per diem that does a few hours for us every week, put together the leader binder. We didn't think it was a big deal. All right, we didn't think the leader binder was going to be a big deal, having the primary verification of everybody's education. At the last minute, on the last day, they decided they wanted to go through every single page and verify all the education of everybody who was in leadership. So thank God we had that. Because it would have been a really tough Friday. So for all you guys, you just gave more than you ever thought you could. You dug stuff up. This lady who dug stuff up, who has every email that has ever transpired.
4 years. So I won't get rid of my delete box, and I hold on to it for 4 years, and then she'll call me in a panic and say, "Do we have evidence of it?" Of course we do.
And those exemplars, not everybody gets exemplars. I know we didn't get exemplars last time. Exemplars are things that are especially worth acknowledging, that are things that are very rare for them to find even in magnet hospitals, that are kind of the keystone of how they want other hospitals to be as well, the example of how everybody else should be as well. So for us to get 3 exemplars, not even the ones we expected, but I mean, you guys with the Foley Project, that was a big story. Several of you are in here for that. The Clabsy Project. Anybody, I don't know if anybody's here from Surgical Services. Elaine. We fought for that story. Our group that was advising us kept saying, no, that's not a story, you can't put that in. And we fought for that story and decided we were putting it in anyway, about near misses and safe surgical care. And so I'm sure Elaine is like dancing on one foot right now. Because that is amazing that got in there, and it's a testament to fighting for what you believe in.
And all 3 of our exemplars are about keeping our patients safe.
Yep. Yes.
And that's a testament to all of us.
Yep. So thank you to Helene, because obviously it's her leadership and her just fighting for nursing and for acknowledgement and for everyone in the world basically to know how excellent our nurses are here. It's just a testament that she never stops. She never stops advocating for nursing. And I'm so glad that we have folks who can go back and tell the whole world how exciting this is. So thank you so much. It means so much to me to have you guys here, but mostly it means so much to have 79 join the Teams meeting and you guys come in this room.
That's-
So, yeah, because that was rooms too.
Rooms, yeah.
Yeah, so thank you all so much. Thank you, Queen, so much.
To be redesignated is huge. As a chief nurse, it really is very huge. It does take the village. But I also had another very nice surprise on Monday. I've been accepted into the fellowship, accepted as a fellow for the American Academy of Nursing. And my application to that, actually I had 2 fellows help me with it, current fellows, and all my application was about the quality over the years of what we have done. You know, I think about, you know, we've struggled recently with falls, we've had problems with cauties, even collapses at times, but we always rally around whatever we have and we make sure we do the right thing. So, you know, it really is a testament to all of you. This is a great organization. I know it's a really hard time for us right now. I think this summer is going to be a rough one, lots of rough waters. But I will say that I wouldn't be in this bad of a situation with anybody else but all of you. so know that we are all here together, and you know we'll get through this patch of life. You know, you always do. It just sometimes seems dark, but it's not. So remember that we're a magnet organization.